Good evening. So, we want to talk about the importance of the overall healthcare work, or the health assurance work as we call it. I'll start by telling you a little bit about what was going on in our firm in 2019. So what happened was we went to our partnership and we said in 2019, because this is when Livongo was really starting to work, which we had built in our offices and a bunch of other companies, that, hey, healthcare is having a really interesting moment, and over the next decade, we can go make a difference in this space. And that we should go invest a significant portion of our funds. We should go think about, intentionally think about the set of companies that need to get built. And it's probably a 10-year journey, and so let's have the patience and commitment to the space. And then COVID happened. So everything that we thought we were going to go do in 10 years essentially ended up being stuff that we think is going to happen in the next 3 to 5 years. So the decisions that we are all making in the next few years are going to set up what the healthcare system is going to look like for the next 50 to 100. And that requires a lot of great intentionality. And our belief is that it's a responsibility that is too big for any single company, and that an entire ecosystem of companies needs to emerge that work together to do this transformation. And the last thing I would say is that for each one of those companies to really solve the problems around what we call health assurance, which is transform healthcare to be proactive, reduce the cost of healthcare GDP, and make it accessible and affordable for all, to really do that is going to require a true collaboration between technology, healthcare, and pharma. And it is for that last reason is why we reached out to Ken and have the conversation of, hey, come help us shape this for the next, the decisions we're making in the next several years because of the consequences that I just described. So maybe, Ken, we can just start with, your perspective on sort of why you joined and decided to go from an enduring long-term institution like Merck to come, work with a firm like General Catalyst.
Well, thank you. First of all, thank you all for being here and giving me an opportunity to give you my views on these issues. So you hit the nail on the head. I've been in Merck for 30 years, and I've had the privilege of being the CEO for now 10 and a half years. Merck is a company that is founded on some very fundamental values. I could just synthesize them by saying scientific excellence is something that's very important, and then patient access has always been very important to Merck. So I've interacted with a lot of people in the tech field, and I've interacted with a lot of people in the venture capital field over the years. But what I found to be different in our first couple of interactions was the shared values. You just alluded to them. The concept that we want to make sure that what we do puts patients at the center of everything, and therefore obviously makes it possible for their providers, empowers their providers to provide the kind of care that they need. Importantly, firm that cares about social inequities. And we know that the pandemic has really shown us that the inequities that we have in our society are much more stark than we ever thought they would be. We know that for African Americans, the pandemic has reduced life expectancy by almost 4 years, compared to about a year for white Americans. And we know that going into the pandemic, there was unequal access to health care across a number of areas in this country. So that whole issue about social and health equity has been very important to me at Merck, and so that's an important thing. The last thing that I think was really important is this concept that, we talk a lot about disrupting industries with tech, right? We disrupt the retail industry, disrupt the automobile industry, for example. Well, the reality of the world is I don't know anybody who wants their health disrupted. People want to know that if, in fact, they're going to be cared for by someone or through something, that they can trust it. So the last thing was this concept of being very intentional around building companies that have as their core element a social responsibility. I've always felt when I came to work every day at Merck, it was a company that had deeply embedded social values as well as scientific values, and that's why I thought this might be a useful thing for me to try to do as we try to change healthcare.
Yeah, you just lived through a really interesting set of choices with the COVID drug that you had at Merck. I'm sure the audience is keen to know what it was like to make those decisions and what was the collaboration between the different stakeholders that had to come together to accomplish those decisions. Will you just talk about that for a few minutes?
So, as you may know, Merck has a drug that's been submitted for EUA now. It's called molnupiravir. It would be an oral agent for COVID-19. It's a nucleoside analog that essentially mimics the RNA in the virus in such a way that it can infiltrate and cause errors in the reproduction of the virus. There's hope that it will be useful because the data suggested that it could reduce hospitalizations by half and deaths by half or more. So to answer your question, the decision was really not a hard one. It goes back to where we started, which is, the company believes in this concept of patient access, and that means global access. And we know that this is a virus that has struck the entire world, that if we don't deal with it in the poorest parts of the world, we'll certainly have viral mutations continuing, variants continuing to spring up. So for us, it was just a question of how do we meet the needs of different stakeholders, right? So obviously, we have our shareholders, and we have to make sure that they get a fair return on their investments. But at the same time, it's a company that cares very much about global access. And so, when you do an Ebola vaccine, for example, you do that not because you think you're going to make money on it, you do it because you think it's the right thing to do. In this instance, looking at this global pandemic, we asked ourselves, how do we optimize patient access and optimize shareholder return? Because to maximize profit is not the right thing. And obviously, if we're going to be a sustainable business model and invent the next drug, we can't just give everything away. So that was how we thought about it. And I think fundamentally it wasn't a hard decision because people said, how should we live the values that are the stated values of the company? And I would say proud to see that the company's behaviors are consistent with what we say our stated values are.
Yeah, look, I think it's the right decision, but it's also an inspiring decision. Think about even other industries like climate change and sustainability. When you think about making these choices and coming up with solutions that have global implications, I'm sure companies will refer back to this example and how you're approaching this as a learning moment.
Well, it's funny that you mentioned climate change because it's very similar. Just like the pandemic is a global problem and it hits different parts of the world unequally. The same with climate change because you have 3 billion more people coming onto the planet in the next 20 years. Most of them are going to be in Africa or Asia. They want to have the right kind of human development, and that might involve the use of some fuels that we're cutting back on in the richer part of the world. So the question is, how do we subsidize? How do we make it possible for people to have the right health care in that area of the world and have the right level of human development around energy in that part of the world?
Yeah.
I have a question for you.
Okay.
General Catalyst has helped transform a number of industries. We started off talking about transformation, and through the digital transformation, you've done it in fintech and consumer tech. So what lessons do you think are applicable to healthcare?
Yeah, it's interesting. First of all, so I've been investing for 20 years. The 20-year arc used to be sell software to different industries to make them efficient, right? To sell software to the healthcare industry or insurance or consumers and whatnot. After the iPhone and Facebook and Amazon Web Services, we started really redefining experiences in those industries. So what does it mean to have a modern insurance product, renter's insurance, for example? Or what does it mean to get chronic care, if you have diabetes, which is what Livongo was? Or what does it mean to consume media on the internet? So as we went down this path of organizing for the last 20 years, content, community, commerce on the internet, it was all driven by serendipity and disruption. So I have to admit, like our view was, go find the next Zuckerberg or the next Patrick Collison or the next Evan Spiegel that's fundamentally thinking about the problem differently, and they'll build something that'll just disrupt what's there and create, pardon the word, but monopolies that own these markets. I mean, that was the mindset. And somewhere along the way we learned, and as we have learned as a society, but that's not a great thing to be doing. As you move from scarcity to abundance, organizing these services on the internet, you don't want a single company or two to have that level of responsibility and power. And you want to watch out for unintended consequences. And so our view going into healthcare and education and other areas now is go from serendipity and disruption to intentionality and collaboration. So we do a lot of work with a lot of health systems, and I always start by saying we bring ignorance and imagination to this sector because we've seen whatever Airbnb did, and we built Kayak and Stripe and Snap and many other interesting companies, but you got to teach us what's happening here. And let's figure this out together as to what does it mean to transition our healthcare ecosystem towards one that's abundant and accessible and affordable, as we said earlier.
Yeah. So we live in a country where 20% of the GDP is in healthcare. We spend a lot on healthcare. But
by the way, that's one thing, which is as a capitalist, we're always looking to increase the GDP of X. And here we have an obligation to say we got to reduce the GDP of healthcare.
That's where I was going.
Right?
I was going. And for the purpose of reinvesting in healthcare that makes a difference. In this country, we spend more on healthcare, and we have some of the worst healthcare outcomes. And certainly, we know that there are places in this country where healthcare is just not made available. So the physical infrastructure, if you will, hospitals, clinics, physician practices. We'll just go back to COVID-19. I saw some data the other day that suggested that the amount of depression and anxiety is 3 to 4 times higher than it was before COVID. Now, obviously, we haven't increased the number of psychiatrists in the country, right? And we know that psychiatrists tend to be in certain areas, not necessarily spread evenly throughout the population. So we have to think about how we create access in a situation where people are suffering, literally, from mental illnesses, and we just don't have the physical infrastructure.
I think it's a great point. I mean, this goes back to how do we do this transformation without causing disruption? On one hand, we're building these software companies that can eliminate a lot of jobs in the healthcare sector because automation can be brought in. On the other hand, we have this problem that you're describing. We don't have a mental health workforce in this country that's truly accessible and to all. We don't have an elderly care workforce. We saw what happened in nursing homes. So to me, this is thinking about the workforce transformation in this industry to say where can automation come in and where can we actually bring empathy and human interaction with consumers is a big problem we have to think about over the next few years.
Yeah, I agree. I think that one of the challenges we have as a country is what level of inequality in healthcare are we willing to accept?
Yeah.
Right? We talked earlier about the situation of getting an oral COVID drug to people in Africa and Asia and places like that. Part of the challenge is what I call the challenge of the last mile. It's not just enough to make drugs available through a license to Indian generic manufacturers. We have to work in collaboration with other people to make sure that it actually gets to the people who need it. Interestingly enough, we have those issues in our country. We are, for example, with respect to women who die in childbirth, we're ranked 45th in the world in terms of maternal mortality. In the inner cities, that last mile is just as much of a problem as it is in some places around the world. We know that in Appalachia, for example, in rural areas, healthcare is not made available. So there's opportunities with technology to actually fix these problems, given that the physical infrastructure can't necessarily get to everyone who needs it.
Yeah, and I think and that's a lot of where many entrepreneurs, I'm sure many in this room are also focused, is going back to organizing care on the internet so it becomes abundant, it's available everywhere. I do think it'd be great to talk about pharma and the biotech sector for
Yep.
a few minutes, because if we're truly going to make a difference for everybody, the cost structure and the mindset in that industry has to also evolve, and we have to bring technology into this. And we were talking about this in the back room. I'd love for you to just share your thoughts on things we and then collectively all of us should also be thinking about in that context.
So again, one of the things that I liked about our first conversations was that you have a lot of respect for the knowledge that's in the industry and the experience that's in the industry. Obviously, things like artificial intelligence, machine learning, things like that can really help us be more efficient in drug discovery. We can test the hypothesis perhaps faster with those kinds of things. And so the question becomes, how do we create the right kinds of partnerships in an industry where the world needs the next great drug, the next great vaccine, but at the same time, the challenges, the economic challenges in the industry are pretty substantial. The cost of bringing a new drug to market continues to increase. The time of market exclusivity continues to shrink, and therefore the return for some drugs continues to shrink. So the question becomes now, how can we use these digital interventions to actually make the industry more productive? And also, again, the access question, get the right drug to the right patient at the right time.
Yeah, I mean, it's really interesting. This is, again, my, being a techie comment. I listen to many of the health system CEOs. They're all there with a great sense of mission. And if only they had some profits in their businesses, they would invest that into the community and work on issues like health equity. I listened to you and I learned about pharma, and obviously folks are in that industry to make a difference. And the return on investment keeps going down in terms of what innovation is bringing. And I think this is the interplay where technology can be a leverage point. Because if you can make this industry more leveraged with technology, maybe we can shrink the cost of GDP and actually make it accessible and affordable to all. I think that's a lot of what I'm looking forward to us, thinking through over the next couple of years as to, hey, how do we tackle that? How do we bring these stakeholders together and come up with the set of companies and ideas that might help get us there?
Well, we've just seen recently, Hemant, the importance of the industry, and I don't want to be self-serving. Albert Bourla is going to come out here in a few minutes. And look, those companies, with the help of technology, develop vaccines in 10 months. I mean, I have to tell you, nobody thought that was possible.
Yeah.
And so we've gotten those vaccines, and we've got the monoclonal antibodies, and technology combined with science has allowed us to have those kinds of breakthroughs. I think the challenge for the industry will be, okay, because we were under such time pressure with COVID, we changed our ways of working. Are we going to continue to do that, or are we going to go back to sort of the way things have always been?
Yeah. Well, look, I know we're coming to the end of time, but I'm incredibly excited over the next few years. And it's also, from our standpoint, we're looking to partner. So startup companies, health systems, pharmaceutical, biotech, we all need to come together and work on these things together. So, hope everybody has a great conference, and thanks for listening to us.
Thank you.